Hi, everyone. My name is Dr. Delia Garcia, and today I'd like to talk to the health professionals, especially those that are looking for something to help their overweight and obese patients. So, by health professionals, you might be a physician, you might be a chiropractor, a nurse practitioner, a nurse, a physical therapy therapist. It doesn't matter, whatever your field of medicine is. But let me start with a little bit about my background. I'm an oncologist, and for 30 years, I practiced my field of oncology specialized in breast cancer. I loved every minute of it. I would do it again in a heartbeat. One of the things, however, that happened to me was that as I was practicing, I started to notice that the patients that were coming to see me were becoming younger and younger. So women in their 40s, 30s, 20s. And I was so disturbed by that. And I wondered, what is going on? Is it any different than what we're seeing today? 6 and 8-year-old children with type 2 diabetes because of being overweight or obese. So the same thing was happening in my medical practice. Of course, not all women with breast cancer are overweight or obese, but many of them are. In fact, 70% of Americans are overweight and half of them are obese. So I saw that in my practice, and I wanted a tool to help women get to a healthier place so that they didn't go through all of this therapy, surgery, chemotherapy, radiation, and then come back with a recurrence or a second cancer. And we know that women that struggle with weight have higher circulating estrogen levels because of that estrogen in their body fat, and that's the precursor for breast cancer. So by getting to a healthy weight, one can definitely significantly reduce the risk of breast cancer. And so 15 years ago, I found a wonderful lifestyle program that includes weekly coaching. The coaching doesn't take much time. It's really a check-in, 5 to 10 minutes a week to hold people accountable, help them move forward with their program. Because as they are doing the program, they're also taking personal responsibility and they're being empowered with the education. So we have educational materials, we have weekly webinars, a weekly newsletter. I happen to have a very active Facebook support group for my clients where they can interact with one another. So that community of support is so important. But also the structured eating plan. With the structured eating plan, we use products called fuelings. They're meal replacements that are protein carbohydrate balanced. They're low glycemic. And there's a lot of science behind the meal replacements. Patients are eating every 3 hours a little something so that they start tapping into their own body fat for the rest of their caloric needs. So we're lowering their calories. They're eating 5 meal replacements a day. And then once a day, they're eating a healthy meal so that from day one, they learn what healthy eating is all about: lean protein and vegetables or a salad, not the junk food, not the sugar, not the bread, all of that. And then over time, once they get to that healthy weight, we help them through transition so they learn how to keep their weight off for life. So we're taking away one of the fuelings at a time and bringing back healthy food, although they can stay on these fuelings or meal replacements going into the future as well. So there's a lot of science behind the program, and there have been clinical studies done at Johns Hopkins University. So that's what attracted me to this particular program. And the results, if people do the program, the results are astounding. So we know that there are so many obesity-related health issues in our country. About 70 to 80% of everything we see in medicine is related to being overweight or obese. Heart disease, for sure. Over 600,000 people die of heart disease each and every year in the United States. And it's a completely preventable disease in most people. So heart disease, hypertension, diabetes, autoimmune diseases, and then there's a whole slew of obesity-related cancers. I already mentioned breast, but also prostate, colon and rectal, liver, pancreas, gallbladder, uterine, ovarian. So all of these very serious health issues that if people really concentrated on their health and well-being and were able to achieve a healthier weight, they could drastically reduce their risk. But what I love about this program also, and this is another reason I wanted to address health professionals, is that what if you could create a vibrant second income stream with this program and business model? What if you could do that? Wouldn't that enhance your own life? First of all, by helping your patients get healthy, there's nothing more exciting and more joyful than that. Taking someone that is really struggling and has a lot of issues, maybe is on quite a few medications, and helping them eliminate some of those medications and improve those health issues. So what if you could do that? But then by engaging in a program and a business model like this, creating a vibrant second income stream for yourself, and even the opportunity to create a plan B, like I was able to do 10 years ago. I left mainstream medicine. But if you love practicing medicine, and maybe you're young and you haven't been practicing medicine all that long, but you'd love to decrease the number of hours that you work by creating the second income stream and being able to help your patients get to a healthier place, wouldn't that be a wonderful thing to achieve? So I am so excited about the possibility of helping other health professionals be able to add this to their practices and be able to create a more balanced life for themselves, maybe working 4 days a week instead of 5, or shorter hours, again, because of that second income stream. So talk to the person that invited you to take a look at this video. If that person is me, then reach out to me. I'd love to share more. But we have such an opportunity as health professionals to really help change the trajectory of people's lives, help them transform their lives, get their lives back, add years to their life by getting to that healthier place and adopting those healthy lifestyle changes.